My name is Joanna Greer McEachin. I'm the Executive Director for ABIPA, also known as the Asheville-Buncombe Institute of Parity Achievement. ABIPA was founded by Dr. Charles Blair back in 2004 because he moved to Asheville and he saw all the disparities that were here. And instead of just saying that there's a problem, he came up with a solution, and ABIPA was one of those solutions.
ABIPA has the opportunity to go into communities and actually serve individuals who are not being served by traditional healthcare entities. They serve as a community advocate so that they can connect them with specific services, connect them with healthcare resources, and more importantly, make sure that they're getting the care that they need. They do health screenings, they do health assessments, and they talk to them as individuals. They make a different connection with people in the community that has to be made, because as healthcare changes and the individuals in the community need more care, the care is not being done by healthcare providers and hospital systems only. It actually has to be a shared resource that you reach out to communities like ABIPA that have these very direct connections in the community.
UNC Asheville is the evaluation partner on the PRAISE initiative, and we've been working with ABIPA for the last 4 years, and it's been a really exciting project because we've been able to utilize the results-based accountability, or RBA format, for the evaluation. And so through this work, we've been able to ask 3 important questions. What have we done? And that means what have we done through the PRAISE program or initiative? And how well did we do it? So how much did we do? How well did we do it? And finally, and most importantly, is anybody better off? And so through congregation level assessments as well as individual level surveys, we have been able to basically track the health and health perceptions of the congregation members, and that usually works out to about 300 people per year, and that is equal to the largest data set of African Americans in the local area.
Mission Health was one of the earlier partners with ABIPA, and we have been so pleased to be their partners in this journey because we believe that health begins in communities, and Kathy and Joanna have such a creative ability to establish relationships and engage people in their health journey. And when you want to improve your health, that can sometimes be scary, and so you want to do that in partnership with someone that you know and trust. And so the PRAISE program has been a wonderful way for Mission Health to partner with ABIPA and make a difference in our community.
And when we first started, I really wasn't into it. And I was asking the Lord to sort of help me. And so he told me that I know that he'll do his part, but I have to do my part.
Amen.
And I took it serious. And since then, I've lost over, since last year, I've lost over 25 pounds.
You teach what you have, and so that's a responsibility that I believe ABIPA has, is to really make sure that people are informed, because knowing is half the battle. And then when you know better, you do better. And we can do better when we do it together.
It has connected with the African American and some other minority communities in a sustained way, with the health fairs, monitoring individuals, teaching them how to monitor their own health indicators.
Someone has to lay the groundwork to prevention, which means the next generation has to have the information, and you have to be growing healthier young people.
I went and had a checkup, and the doctor said, man, whatever you're doing a good job. I said, well, it's an investment. It's an investment.